As a CNL, I believe that CNLs within the practice arena are having an unmeasurable impact on healthcare. Partly because we look at those things that nurses at the bedside are not afforded the time to look at. We step back and look at the big picture of what's going on with the patient. We take a second to see if what we're actually doing is working for the patient. And then we have an opportunity to build those relationships with the patient and their family to really get in there and see, you know, from a personal standpoint, what is it that they're dealing with outside of the hospital that may readmit them or may keep them from being successful in the plan of care whenever they discharge to home or to the skilled nursing facility or wherever they're leaving after the hospital. But I feel like the clinical nurse leader is the answer to healthcare simply because nurses are running at 110 miles an hour. Physicians are running at 110 miles an hour. Every interdisciplinary teammate is running at 110 miles an hour trying to take care of a patient. But no one's actually taken a second to step back and see, is it working? Is what we're doing actually working in this patient's life? And have we taken a second while we're trying to fix the patient to make sure that it's even what the patient wants?
The Clinical Nurse Leader program at Augusta University is about 10 years old, really about 11 years old now, because we started early in the game. And we had a little bit of a unique approach to it in that we wanted the master's entry student, the student who already had a career degree in another field and was interested, always wanted to be a nurse many times. Some are straight out of the college degree in psychology or biology, animal science, all of those. So we opened our doors to that group of potential nurses and to become nurses at the master's level. And when the student finishes our accelerated master's program, they have a master's degree, MSN, Master of Science in Nursing. They are eligible to take the licensing exam, and they're already eligible to take the National Clinical Nurse Leader exam. So we've been very fortunate that that model really has been successful in our area. The Clinical Nurse Leader graduates from Augusta University are brand new nurses as well as brand new CNLs. So their impact is sometimes delayed while they're getting their feet on the ground as a new nurse. However, the most progressive chief nursing officers immediately put them into some track, a leadership track, so they can start showing that education that they have from the day that they enter their institution. So the impact they have is they start very early looking for needs for improvement, and they start evaluating earlier than other people do, and they take this knowledge to create new safety programs, new quality programs, overcome barriers to quality care, patient-centered care, and so on. So they tell us, the chief nursing officers tell us, that our graduates start making an impact on their institutions very quickly. When we initiated the CNL role, I took the program on the road and I visited chief executive officers and chief nursing officers. And I made the case for the fact that we were providing a new graduate, a new type of graduate with a new skill set. I did not talk about a CNL role. I talked about the fact that the CNLs were much more analytical, they had more leadership training, they had more care management training, they understood how to remove barriers on a small unit, and those kinds of things that I was able to take and show and explain as we were trying to convince these individuals that they would really like to have our students. Not our graduates at that point, but to take our students. And that worked. We had people who very quickly sponsored that group and helped us and advised us how to change and get better from year to year. Working with the chief nursing officers has been probably our most successful strategy, not only to prepare our students and make sure that the students can have appropriate clinicals in the institutions, or to make sure they get hired upon graduation. One other area that we're really happy about with our program is that our CNL graduates often are in orientation the week after they graduate for their next educational program. So we see that the CNLs are fairly quick to come into our DNP program, our Doctor of Nursing Practice program, in advanced practice tracks, and that has been very successful. Others have come into our PhD program. Some have already had research backgrounds before they came to be into our program, and then they've continued their research through the PhD program. So that has been another way that we can say the impact has been to further the education, and they return as teachers. The CNL graduate, after about a couple of years, are willing to come back and help us teach our clinical experiences for our students. And we're very fortunate to have them. We know how good they are. We know they already have the leadership. We know where they've been working. And then they come back a day or two a week and help us with our clinical teaching. And it is spectacular teaching. They're so energetic. They're so cutting edge. They're leaders already. They're great role models. And that impact on our teaching at this time when we have so many nursing students has just been phenomenal for us.
CNLs have had a big impact at MD Anderson in our practice environment. We implemented the CNL role almost 5 years ago after about an 8-year project to talk about the role and talk about practice changes at our hospital. We changed our practice environment and our model of care, and part of that was the CNL role. So we have placed CNLs on all of our inpatient units, and after about 4 years, we are now hearing people say, I need the CNL. I want the CNL. Can we have a CNL on this committee? Can we have a CNL on this project? We've had some challenges. It was a new role, new things for people to get their head around and learn to adjust to. What does this person do? I don't understand. What do they do all day? Why aren't they taking care of patients? All kinds of questions like that. But we've worked our way through, and the CNLs have done a great job of establishing themselves as part of our care delivery team. CNLs have greatly enhanced patient care on the units where they have been there, especially for a number of years now. They have really pulled the teams together to work as a team. Teamwork's been one of the big emphasis in our new care delivery model. And so as we've worked with these teams, the CNLs have been kind of the champion for how to work as a team. They get in there, they're at the bedside, they help with projects about improving quality or process improvement. But lately we've really been working on things like skin care for our patients and the reduction of skin injury. So our CNLs are right there making rounds every day, turning patients over. In fact, we had a comment on a patient satisfaction survey recently that said, I loved my stay at MD Anderson, but they wanted to look at my butt every day. And really, we count that as a win because they're doing what they need to do. So now the CNLs are driving that to the bedside nurse. So it's not just the CNL that turns the patient over every day. The bedside nurse says, hey, will you come with me? I'm about to give this bath, or I'm about to do this. Can we look at my patient's skin? I'm not quite sure what this is. So it's been a big win for us, and it's being demonstrated across the organization, and people are taking notice. We have a great partnership with several universities, and as we've gone through our partnership for the CNL program, one of the things we've learned is what the education can bring to us as an organization. But part of that, too, has been working with the universities to tweak the curriculum and look for things that really make CNLs interesting to other employers. We've certainly hired, we have about 32 CNLs now, most of whom came from within our organization. But when I interview someone from outside of the organization, I'm looking for someone who really understands the role and someone who really understands quality. So quality is the big key. quality is the key in how to drive patient care and make it better, but also understanding how to analyze data. So data, quality, they all go together, and those are the things I really look for outside of the personality and the ability to interact with people. I want to know that a new CNL has the basics to begin process improvement and to understand the data that they receive to improve patient care. One of the things I love most about the CNLs is how they work with the interprofessional team. So the doctors and their advanced practice nurses or their physician assistants round every day on the inpatient units to see their patients. The first thing they do now is want the CNL to round with them. So the CNL is pulling all those strings together. We're a large institution. Lots of people see patients. People walk in and out of their room in scrubs and lab coats all day long, and they don't know if that was a nurse or a physical therapist or the case manager or the doctor. And so the CNL helps pull all of that together, and they tend to be the central hub of the interprofessional team that everyone goes to for the information, and then they send that information back out to coordinate the patient's care. It really works when you're talking about complex, maybe a stem cell transplant patient who's been in the hospital for 30 days. That CNL knows everything that's happened over the course of that patient's stay, and they pull the case manager and the family and the physicians together to make sure that they have the best plan moving forward so that that patient's successful when they go home and doesn't end up back in the hospital.
I get many, many phone calls from all over the country, and I think the major reason people call me is, why should I hire a clinical nurse leader? What kind of an impact, if I hired a clinical nurse leader, would they have on my organization? And I basically tell them the story of about 10 years ago at Hunterdon Healthcare System, where you have to have a leap of faith, and that was before you had data. That was before we even knew the clinical nurse leader had that kind of efficiency and transformational ability to change an organization. And when you have that leap of faith and you are committed to a culture of safety and you want an exemplary nursing department, you think of every possible way that you can start hiring a clinical nurse leader. And so I tell them that you have to have a leap of faith. You have to have the support from the executives that you work with. And then when you do that, you then will see the difference that a CNL makes over time. So you have to have patience, and you have to support them in the way that they need to be supported, and also to really explain to the organization what this role is. There's a lot of confusion about the role in the beginning, but once the role gets rolled out and you see the impact that they have, I think that is what really makes the difference. One of the other things I tell them is, because we're in a process of an accountability-based organization, and the government or other insurance companies are putting our feet to the fire, everything is about data. And the CNLs are expert in not only changing microsystems at the point of care, but they're also very, very good at evidence-based research and also being able to produce the data that we're looking for and making a difference with outcomes. So that leap of faith for me as the chief nursing officer 10 years ago, when I hired 6 of them, we hit the floor running. And there was no preceptor. I was their preceptor, and really protected them and made sure that they weren't going to unnecessary meetings, and really helped the organization support these CNLs so they could do their jobs. So I would say at about 6 months, we could definitely see the difference in our indicators, by the national data, NDNQI data sets. And I would present that data to the Board of Trustees or the Chief Medical Officer or the executive team. And when they could see that data change over time, it was like, okay, I want to have more CNLs, or the doctors wanted to have CNLs. So I think that was the proof in the pudding, when they could actually see the difference that they made. 2 years after that they were hired, Magnet came, because we were applying for Magnet status. And of course we got it. And one of the areas that were exemplar was the clinical nurse leaders. The future of the CNL, I think, is going to be quite inspiring. Whether we have the Affordable Care Act or not, I think that all the organizations are being held to a higher standard. I think we're seeing that the fee-for-service is going away, that we're seeing that hospitals are being judged by quality outcomes, by readmission rates. I think as a consumer, we are demanding that we go into a hospital, that we don't have an infection. All those things are playing, plus the whole notion of community health is coming back again, for hospitals to take responsibility for their community that they serve in terms of prevention. So when you think of even the opium situation that we have, the mental health crisis, access, homelessness, years ago, the CNL was just thought of as a acute care clinical nurse leader in a hospital setting because of the Institute of Medicine report about the 100,000 deaths, per year. But now, my vision is that I think the CNL is so effective because of their education that their skill set can be used in community, in prevention, dealing with the homelessness in practice areas, physician practice areas. I mean, the sky is the limit because they have the tools that are so necessary in terms of quality outcomes.
In my mind, there are three key reasons why an employer should hire a CNL. One is patient satisfaction. Who wouldn't want the best role in nursing, the best nurse trained in this role to take care of you and orchestrate your care? Quality and safety. CNLs have been trained on as system analysts. They get the big picture. Finance and costs. CNLs have proven to be cost effective. At my facility, there's 6 CNLs that just worked on a project and have regained $3 million in lost revenue. CNLs raise the bar on patient care. We are the extra set of eyes and ears that ask the question, what more can we do for our patients and families? Not only do we work in the units we were assigned to, but we cross borders and go into the community setting to ensure the patient's story isn't lost. We work with the patient and the families so that we can come up with an individualized plan of care. And we are the bridge between the interprofessional teams to ensure that there is communication and accountability between the interprofessional teams to ensure that the care plan is followed.